Is experiencing a dangerous shortage of mental health professionals. Now, underserved populations in East Texas may have some luck within their school system. Fox 51 Good Day anchor Raina Revel on access to the right type of care in the classroom. In the second part of our special report, a breakdown of mental health in East Texas.
So, I think we've always had people struggling with mental health issues at one point or the other, some severe, some minor.
Many children and adolescents are struggling right now, experiencing poor mental and emotional health. Cases are being linked to negative impacts of the pandemic and gun violence.
We all kind of go through periods of heightened stress and periods of adjustment, in our families, with our kids. Just existing as a human being can be really hard sometimes, and I think a lot of times if people kind of reached out for help earlier, they would kind of get the support and maybe learn some of those skills that they need so that larger issues didn't happen later on.
To tackle these concerns, 2022's Bipartisan Communities Act passed over $1.3 million to support school-based mental health services for students.
The purpose of that money, or what it's going to be used for, is kind of in a couple of different areas. The first is to increase the amount of mental health services that are being provided in the schools.
Tyler, Winona, and Brownsboro ISDs are partnering with UT Tyler, providing mental health professionals in our East Texas schools.
So we're going to be able to increase the amount of interns that we put from our program into their schools who can directly provide counseling services to their students. Those interns are also going to be paid for the work that they're doing, which is great because that helps to support our graduate students here.
School-based services in other districts like Henderson ISD can also reduce access barriers for underserved populations.
One of the new things we're doing here is we have a program called Care Solace. And basically, Care Solace acts as a liaison between families and mental health care providers. So what we do is our counselors, they identify that a student has a mental health need that exceeds what we can provide within a school day.
Care Solace will then put the family in touch with the right medical provider.
I do know that a lot of those different entities do provide mental health care at no cost or a very low cost.
Providing all families in need with the right tools toward a healthier and happier future. Raina Revel, Fox 51 News.
This is the second of 5 stories on the state of mental health and its access here in East Texas. Join us tomorrow on Fox 51 News at 9 as we focus on how exactly social media can play a role in the state of our mental health. And if you or someone you know are looking for mental health care resources, we have more information on our website, fox51.com.